What if I told you that herpes is more common than you think, and it's not just a dirty disease? I mean, from celebrities to athletes to even your neighbors, herpes does not discriminate. And you might think that you know what herpes looks like, but the truth is, not everyone presents with symptoms when they have the condition. That is why in this video, we're going to be setting the record straight and understanding what herpes really is. Hi lovelies, welcome back to Isiolena's Corner. If you're stopping for the first time, I'm your host Isolena, and I am a registered nurse, a midwife, as well as a professional makeup artist. And over here we discuss all things pertaining to faith, health, nursing, and beauty. So if these are the kind of contents you're looking out for, please do not hesitate to like, to share, and subscribe. Join the family. Now in today's video, we're going to be discussing a very important condition called herpes. We're going to be dissecting what herpes is, the symptoms, the treatments, as well as the preventions that are available. Herpes is a highly contagious and common viral infection that affects millions of people in the world, and despite the prevalence of this condition, there's still a lot of stigma and misinformation associated with it. That is why awareness and education is very important, so as to prevent the spread of this condition and also show support to those persons who are living with this condition. Now, as a way of kickstarting this video, let's first and foremost understand what herpes is. Herpes is a viral infection that is being caused by herpesimplex virus, or HSV, and this condition is being characterized by the presence of blisters on the body. Now, the mode of transmission of this condition is through skin-to-skin contact, including kissing, so you can transfer it through skin-to-skin contact. Now, what are the types? There are two types of viruses that are responsible for this condition. We have the HSV1 and the HSV2. Now, what is the pathway of this condition in the body, or pathophysiology of this condition? Now, once a person gets in contact with someone who has the virus, and the virus has been able to successfully enter into the body, what it does is that it tries to replicate itself. And how it does this is that it tries to mimic the body's natural cells and replicates itself in the body. But after doing that, it becomes dormant. Yes, it becomes dormant. But the fact that it's dormant doesn't mean it cannot later on become active. It can, by certain factors triggering it. The dormant herpes virus can now become active later on. What factors are responsible for this? Factors such as hormonal changes can trigger this. Also, a suppressed immune system, for example, in individuals who have HIV and the likes. Also, another factor is the trauma to the mouth or other parts of the body. Also, sun exposure. Yes, it can trigger this. Sometimes stress as well can trigger the dormant herpes virus to become an active herpes. Now, what are the symptoms associated with this condition? Actually, most persons present without symptoms when it comes to this condition. But for those who experience symptoms like headaches, sore throats, swollen lymph nodes, body aches, fever, they could experience those. But the most common symptom is experiencing blisters around the mouth or the lip or the genital region. All these are present in individuals who have this condition. Now, diagnosis of this condition remains through physical examination. Remember, I said the most common symptom is presence of blisters around the mouth. So physical examination as well as blood tests would help indicate whether the person has herpes or not. Now, let's talk treatment. When it comes to treatment, herpes does not have a cure. That's just the thing. It doesn't have a cure. So whatever treatment that is being done is to reduce the impact of the symptoms in the lives of the individuals that are experiencing it. Now, treatments such as antiviral medications are given. Also, pain relief is given to help combat the pain that the person will be experiencing. Now, let's talk prevention. One way of preventing this condition is to avoid contact with people that are already infected. And from the symptoms I talked about, you know those who are infected, so avoid contact with them. Remember, it doesn't have a cure, so you don't want to play with your life. But that doesn't mean you should not support those who already have the condition, because for me, I am totally against stigmatization of people with this. And with that, we've come to the end of this video. I hope it was helpful. I hope it was educational. If you have any question, please leave it in the comment section down below. And let's see you next time. Bye, lovelies, and God bless you.